Today we're diving into a topic that affects millions of men worldwide: prostate health. You see, while we often focus on the foods that can boost our well-being, it's equally important to be aware of those that might be doing more harm than good. So, if you're ready to take control of your health and learn about the foods you might want to watch out for, then stick around. Because in this video, we're uncovering the truth about these harmful foods and their effects on your prostate. Let's dive in. First, we have alcohol. One major issue with alcohol is its ability to cause hormonal imbalances. Alcohol consumption can lead to an increase in the production of certain hormones, such as estrogen, while simultaneously decreasing testosterone levels. This hormonal disruption can contribute to the development of benign prostatic hyperplasia, BPH, a condition characterized by an enlarged prostate that can cause urinary problems and discomfort. Additionally, the altered hormone levels can promote the growth of prostate cancer cells, increasing the risk of developing this serious condition. Inflammation is another key factor in how alcohol harms the prostate. Alcohol is known to induce inflammation throughout the body, including in the prostate gland. Chronic inflammation can damage prostate cells and tissues, leading to prostatitis, a painful condition that causes swelling and irritation of the prostate. Persistent inflammation is also a risk factor for prostate cancer, as it can cause DNA damage and promote the development of cancerous cells in the prostate. Moreover, alcohol's diuretic effect can exacerbate prostate issues. As a diuretic, alcohol increases urine production, leading to more frequent urination. For individuals with prostate problems, such as BPH or prostatitis, this can aggravate symptoms by increasing urinary urgency and frequency, thus impacting overall quality of life. The strain on the bladder and urinary system caused by alcohol can further complicate existing prostate conditions and contribute to ongoing discomfort. The liver, which plays a crucial role in metabolizing alcohol, can also indirectly impact prostate health. Chronic alcohol consumption can lead to liver damage and impair its ability to detoxify the body. A compromised liver can lead to a buildup of toxins in the bloodstream, which can reach the prostate and other organs, potentially causing further damage and inflammation. This toxic buildup, coupled with the other harmful effects of alcohol, underscores the importance of moderation in alcohol consumption to maintain prostate health. Next, we have canned fruit drinks. One of the primary concerns with canned fruit drinks is their high sugar content. Excessive sugar intake has been linked to obesity, insulin resistance, and chronic inflammation, all of which can contribute to prostate problems. High blood sugar levels can lead to increased insulin production, and insulin-like growth factors can stimulate the growth of prostate cells, potentially leading to benign prostatic hyperplasia, BPH, or even prostate cancer. Additionally, chronic inflammation resulting from high sugar consumption can damage prostate cells and tissues, increasing the risk of prostatitis and other inflammatory conditions. Artificial additives and preservatives commonly found in canned fruit drinks also pose risks to prostate health. These chemicals can disrupt the endocrine system, leading to hormonal imbalances. Hormones play a crucial role in prostate function, and any disruption can have adverse effects. For example, certain preservatives and additives can mimic estrogen, leading to higher estrogen levels in the body and lower testosterone levels. This hormonal imbalance can promote the growth of the prostate gland, contributing to conditions like BPH and increasing the risk of prostate cancer. Moreover, the acidic nature of many canned fruit drinks can have a detrimental impact on the urinary system, which is closely linked to prostate health. The high acidity can irritate the bladder and urinary tract, exacerbating symptoms of prostate conditions such as frequent urination and urgency. For individuals already suffering from prostate issues, this added irritation can worsen their symptoms and affect their overall quality of life. Next, we have cherries. Cherries, particularly tart cherries, contain high levels of natural sugars. Excessive sugar consumption can lead to metabolic issues such as insulin resistance and obesity, both of which are risk factors for prostate problems. High blood sugar and insulin levels can contribute to chronic inflammation, which in turn can damage prostate cells and tissues. Chronic inflammation is a known risk factor for prostate conditions such as benign prostatic hyperplasia, BPH, and prostate cancer. Therefore, while cherries in moderate amounts can be beneficial, Consuming them in large quantities may contribute to these metabolic disturbances. Oxalates, naturally occurring compounds found in cherries, can also pose a risk to prostate health. High intake of oxalates can lead to the formation of kidney stones, which can indirectly affect the prostate. The prostate and urinary system are closely linked, and issues in one area can often impact the other. Kidney stones can cause significant urinary tract irritation, and this irritation can exacerbate symptoms of existing prostate conditions such as BPH or prostatitis. Furthermore, the pain and discomfort from kidney stones can indirectly affect prostate health by increasing stress and inflammation in the body. Cherries are also rich in certain plant compounds, such as flavonoids and anthocyanins, which are generally considered beneficial due to their anti-inflammatory and antioxidant properties. However, in some cases, these compounds can interact with medications used to treat prostate conditions. For instance, individuals taking medications for BPH or prostate cancer may experience altered drug efficacy due to interactions with the high levels of flavonoids and anthocyanins in cherries. It's essential for individuals with prostate conditions to consult with their healthcare provider about their diet to avoid any adverse interactions. Another consideration is the potential for allergic reactions. While rare, some individuals may be allergic to cherries, leading to symptoms that include inflammation and swelling. Allergic reactions can cause systemic inflammation, which may negatively impact prostate health. Chronic inflammation is a significant risk factor for prostate issues, including prostatitis and cancer. Therefore, it is crucial for individuals with a known allergy to cherries to avoid them to prevent any inflammatory responses that could affect the prostate. Next, we have citrus fruit juice. Citrus fruit juices are highly acidic, which can irritate the urinary tract and exacerbate symptoms of prostate conditions. For individuals with benign prostatic hyperplasia, BPH, or prostatitis, the increased acidity from frequent consumption of citrus juices can lead to heightened discomfort, increased urinary urgency and frequency. The irritation of the bladder and urethra can make it more difficult to manage symptoms, affecting the quality of life for those with prostate issues. High sugar content is another concern with citrus fruit juices. Many commercially available citrus juices contain added sugars to enhance flavor. Excessive sugar intake can lead to obesity, insulin resistance, and chronic inflammation, all of which are risk factors for prostate problems. High blood sugar and insulin levels can stimulate the growth of prostate cells, potentially leading to the development of BPH and increasing the risk of prostate cancer. Additionally, chronic inflammation associated with high sugar consumption can damage prostate cells and tissues, further contributing to the risk of prostate-related diseases. Another property of citrus fruit juices that can be harmful is their potential to interact with medications. Citrus juices, particularly grapefruit juice, are known to interfere with the metabolism of various drugs. This interaction can alter the efficacy of medications prescribed for prostate conditions, such as alpha blockers and anti-inflammatory drugs. When the metabolism of these medications is affected, it can lead to inadequate symptom control or increased side effects, complicating the management of prostate health. Next, we have curcumin. One concern with curcumin is its potential interaction with hormonal therapies used in treating prostate cancer. Curcumin has been shown to influence androgen levels, which are crucial in the development and progression of prostate cancer. While some studies suggest that curcumin might reduce androgen activity, which could theoretically benefit prostate cancer patients, others indicate that it could interfere with androgen deprivation therapies. These therapies aim to lower androgen levels to control cancer growth, and curcumin's impact on hormone levels might undermine the effectiveness of such treatments, complicating disease management. Curcumin's anticoagulant properties also pose risks, particularly for individuals undergoing prostate surgery or those on blood-thinning medications. Curcumin can enhance the effects of anticoagulant drugs, increasing the risk of bleeding. For patients scheduled for prostate surgery, excessive bleeding can lead to complications and prolonged recovery times. Additionally, for those taking anticoagulants to manage other health conditions, combining these with curcumin supplements without medical supervision could result in dangerous bleeding episodes. Bioavailability is another issue with curcumin that can indirectly affect prostate health. Curcumin is not easily absorbed by the body, leading many to take it in high doses or in formulations designed to enhance its absorption. High doses of curcumin can cause gastrointestinal issues such as nausea, diarrhea, and stomach cramps. For individuals with prostate conditions, maintaining overall health is crucial, and gastrointestinal distress can lead to additional discomfort and complications. Lastly, the quality and purity of curcumin supplements can vary widely. Some products may contain contaminants or adulterants that pose health risks. Poor quality supplements might not provide the purported benefits and could introduce harmful substances into the body. Ensuring the use of high-quality, third-party tested curcumin supplements is essential to minimize these risks. Next, we have dairy. One of the primary concerns with dairy consumption and prostate health is the presence of hormones in milk and other dairy products. Dairy cows are often treated with hormones to increase milk production, and these hormones can remain in the dairy products consumed by humans. Increased levels of insulin-like growth factor 1, IGF-1, in the body, a hormone found in milk, have been linked to the development and progression of prostate cancer. High levels of IGF-1 can stimulate the growth of prostate cells, potentially leading to an increased risk of cancerous growths. Saturated fats, which are abundant in many dairy products, also pose a significant risk to prostate health. Diets high in saturated fats have been associated with an increased risk of prostate cancer and other prostate-related issues. Saturated fats can lead to chronic inflammation, which is a known risk factor for various types of cancer, including prostate cancer. Chronic inflammation can damage prostate cells and tissues, creating an environment conducive to the development of malignancies. The calcium content in dairy products, while beneficial for bone health, can also have adverse effects on the prostate when consumed excessively. High calcium intake has been linked to an increased risk of developing prostate cancer. Excess calcium may reduce the levels of vitamin D in the body, a nutrient that is essential for maintaining prostate health. Vitamin D has protective effects against cancer, and a deficiency can make the prostate more vulnerable to cancerous changes. Dairy consumption can also lead to hormonal imbalances that affect prostate health. Dairy products contain estrogens, which can disrupt the hormonal balance in men. Elevated levels of estrogen have been associated with an increased risk of prostate cancer. Men with higher dairy consumption may experience hormonal shifts that could potentially influence the growth and development of prostate tissues, increasing the likelihood of cancer. Next, we have energy drinks. One of the primary concerns with energy drinks is their high caffeine content. Caffeine acts as a stimulant, which can increase heart rate and blood pressure. High caffeine intake has been associated with increased levels of stress hormones such as cortisol. Elevated cortisol levels can lead to chronic inflammation, a condition that is detrimental to prostate health. Chronic inflammation can damage prostate cells and tissues, increasing the risk of conditions such as prostatitis, benign prostatic hyperplasia, BPH, and even prostate cancer. Furthermore, excessive caffeine can lead to dehydration, which can exacerbate urinary problems often associated with prostate conditions. The sugar content in energy drinks is another significant concern. Many energy drinks contain high levels of added sugars, which can contribute to obesity and insulin resistance. Obesity is a known risk factor for prostate problems, including BPH and prostate cancer. Insulin resistance can lead to higher levels of insulin and insulin-like growth factors, which can promote the growth of prostate cells and potentially lead to cancerous changes. Additionally, high sugar intake can lead to chronic inflammation, further compounding the risk of prostate issues. Artificial additives and preservatives found in energy drinks also pose risks to prostate health. These chemicals can disrupt endocrine function, leading to hormonal imbalances. Hormones play a crucial role in maintaining prostate health, and any disruption can have adverse effects. For example, some additives can mimic estrogen, leading to elevated levels of this hormone in men. Increased estrogen levels are associated with a higher risk of developing prostate cancer. The long-term consumption of energy drinks with such additives can therefore contribute to hormonal imbalances that negatively affect the prostate. The diuretic effect of caffeine in energy drinks can exacerbate urinary symptoms, particularly in individuals with existing prostate conditions. Increased urine production can lead to more frequent urination, urgency, and discomfort, which are common symptoms of BP8 and prostatitis. For individuals with prostate issues, the diuretic effect can lead to increased strain on the bladder and urinary tract, worsening their symptoms and affecting their quality of life. Next, we have fizzy drinks. One of the main concerns with fizzy drinks is their high sugar content. Regular consumption of sugary beverages can lead to obesity, which is a known risk factor for prostate problems, including benign prostatic hyperplasia, BPH, and prostate cancer. Excessive sugar intake can also lead to insulin resistance and higher levels of insulin-like growth factors, which can stimulate the growth of prostate cells and potentially lead to cancerous changes. Moreover, high sugar levels can cause chronic inflammation, which is detrimental to prostate health and increases the risk of developing prostate-related conditions. The acidic nature of fizzy drinks can also be harmful to prostate health. The acidity of these beverages can irritate the bladder and urinary tract, exacerbating symptoms of prostate conditions such as BP8 and prostatitis. For individuals with prostate issues, the increased acidity can lead to more frequent and urgent urination, causing discomfort and affecting their quality of life. Chronic irritation of the urinary tract can also lead to inflammation, further complicating prostate health issues. Caffeine, often present in fizzy drinks, poses additional risks. While not all carbonated beverages contain caffeine, those that do can lead to increased production of cortisol, a stress hormone. Elevated cortisol levels can cause chronic inflammation, which is harmful to the prostate. Furthermore, caffeine has a diuretic effect, increasing urine production and potentially aggravating urinary symptoms associated with prostate conditions. Dehydration resulting from excessive caffeine intake can also worsen these symptoms and strain the urinary system. Phosphoric acid, commonly found in cola-type fizzy drinks, can also have negative effects on prostate health. High intake of phosphoric acid can disrupt the balance of minerals in the body, leading to reduced calcium levels. Calcium is vital for maintaining strong bones and overall health, and deficiencies can indirectly impact prostate health. Additionally, phosphoric acid can contribute to kidney stone formation, which can cause significant urinary tract irritation and complications for those with prostate issues. Next, we have grapes. One concern with grapes is their high sugar content. Grapes, especially the sweeter varieties, contain significant amounts of natural sugars. Excessive sugar intake can lead to metabolic issues such as insulin resistance and obesity, both of which are risk factors for prostate problems. High blood sugar and insulin levels can contribute to chronic inflammation, which is known to damage prostate cells and tissues. Chronic inflammation is a major risk factor for prostate conditions such as benign prostatic hyperplasia, BPH, and prostate cancer. Therefore, while moderate consumption of grapes can be beneficial, consuming them in large quantities may exacerbate these metabolic disturbances. Pesticide residues on grapes are another potential risk to prostate health. Grapes are often treated with pesticides to protect them from pests and diseases. Residues of these chemicals can remain on the fruit even after washing. Some pesticides are endocrine disruptors, meaning they can interfere with hormone levels and function. Hormonal imbalances can have adverse effects on prostate health, potentially increasing the risk of developing prostate cancer. Choosing organic grapes or thoroughly washing them can help reduce exposure to these harmful chemicals. Grapes also contain oxalates, naturally occurring compounds that can contribute to the formation of kidney stones when consumed in high amounts. Kidney stones can indirectly affect prostate health by causing significant urinary tract irritation and increasing the risk of urinary tract infections, UTIs. The urinary system and prostate are closely linked, and issues in one area can impact the other. For individuals with a history of kidney stones or prostate conditions, it is important to monitor grape consumption to avoid exacerbating these problems. Allergic reactions to grapes, although rare, can also pose risks to prostate health. Allergic reactions can cause systemic inflammation, which negatively impacts overall health, including the prostate. Symptoms of a grape allergy can include hives, swelling, and respiratory issues. Chronic inflammation from allergic reactions can create an environment conducive to the development of prostate issues, including prostatitis and cancer. Individuals with known allergies to grapes should avoid them to prevent inflammatory responses that could affect the prostate. Next, we have pecans. One primary concern with pecans is their high fat content. While the fats in pecans are mostly healthy unsaturated fats, they are also high in calories. Consuming large amounts of pecans can contribute to excessive caloric intake, potentially leading to weight gain and obesity. Obesity is a known risk factor for various prostate issues, including benign prostatic hyperplasia, BPH, and prostate cancer. Excess body fat, particularly around the abdomen, can increase inflammation and hormonal imbalances, both of which negatively impact prostate health. The oxidative stress caused by high-fat diets is another concern. Although pecans contain antioxidants, high-fat diets can lead to an imbalance between antioxidants and free radicals in the body, resulting in oxidative stress. Oxidative stress can damage cells and tissues, including those in the prostate. Over time, this cellular damage can contribute to the development of prostate conditions, including cancer. Maintaining a balanced diet that moderates fat intake is essential to reduce oxidative stress and protect prostate health. Another issue with pecans is their potential to cause allergic reactions. Nut allergies are common and can range from mild to severe. Allergic reactions can trigger inflammation throughout the body, including the prostate. Chronic inflammation is a risk factor for prostate issues, including prostatitis and prostate cancer. For individuals with known nut allergies, consuming pecans can lead to systemic inflammation, exacerbating existing prostate conditions or increasing the risk of developing new issues. The potential for pecans to interfere with certain medications is also a concern. Some compounds in pecans may interact with medications used to treat prostate conditions or other health issues. For example, the high fiber content in pecans can affect the absorption and efficacy of certain medications. This can lead to inadequate symptom control or increased side effects, complicating the management of prostate health. Individuals taking medications should consult with their healthcare provider to ensure that their consumption of pecans does not interfere with their treatment. Next, we have pineapple. Pineapple is a tropical fruit known for its sweet taste and nutritional benefits, but there are properties within pineapple that could potentially harm prostate health if consumed excessively. One primary concern is the high sugar content of pineapple. While natural sugars are present in all fruits, including pineapple, excessive sugar intake can lead to metabolic issues such as insulin resistance and obesity. Additionally, pineapple contains an enzyme called bromelain, which has both anti-inflammatory and proteolytic properties. While bromelain is generally considered beneficial and is used in supplements for various health purposes, excessive consumption or supplementation may have adverse effects on prostate health. Bromelain's proteolytic properties could potentially interfere with the normal functioning of prostate cells and tissues, leading to inflammation or other prostate issues. Therefore, it is essential to consume pineapple in moderation and consult with a healthcare provider before using bromelain supplements, especially for individuals with existing prostate conditions. Another aspect to consider is the acidity of pineapple. Pineapple is naturally acidic, which can irritate the bladder and urinary tract. For individuals with prostate issues such as BPH or prostatitis, the increased acidity from consuming pineapple may exacerbate urinary symptoms like urgency, frequency, and discomfort. Chronic irritation of the urinary tract can further complicate prostate health issues and affect overall quality of life. Therefore, those with prostate conditions may need to monitor their intake of acidic foods like pineapple to manage their symptoms effectively. Furthermore, allergic reactions to pineapple can pose risks to prostate health. While rare, some individuals may be allergic to pineapple, experiencing symptoms such as itching, swelling, or difficulty breathing. Allergic reactions trigger inflammation throughout the body, which can negatively impact prostate health. Chronic inflammation is a significant risk factor for prostate issues, including prostatitis and prostate cancer. Therefore, individuals with known pineapple allergies should avoid consuming it to prevent inflammatory responses that could affect the prostate. Last, we have spicy foods. Spicy foods, known for their intense flavors and heat-inducing ingredients, can have both positive and negative effects on health. While some people enjoy the kick that spicy foods provide, there are properties within these foods that could potentially harm prostate health if consumed excessively. One concern with spicy foods is their capsaicin content. Capsaicin is the compound responsible for the heat in chili peppers and other spicy ingredients. While capsaicin has been studied for its potential health benefits, including pain relief and improved metabolism, excessive consumption can lead to digestive issues. Spicy foods can irritate the gastrointestinal tract, leading to symptoms such as heartburn, acid reflux, and stomach ulcers. Chronic digestive issues can indirectly affect prostate health by causing inflammation and discomfort, which may exacerbate existing prostate conditions or increase the risk of developing new issues. Moreover, the impact of spicy foods on the urinary system is another consideration for prostate health. Spicy foods can irritate the bladder and urinary tract, leading to increased urgency, frequency, and discomfort during urination. For individuals with prostate issues such as benign prostatic hyperplasia, BPH, or prostatitis, the irritation caused by spicy foods can worsen urinary symptoms and affect overall quality of life. Managing urinary symptoms is crucial for prostate health, and avoiding or moderating the consumption of spicy foods may help alleviate discomfort. Additionally, spicy foods can contribute to dehydration. Capsaicin stimulates the production of sweat and increases body temperature, leading to fluid loss. Dehydration can concentrate urine and irritate the bladder and urinary tract, exacerbating urinary symptoms associated with prostate conditions. Adequate hydration is essential for maintaining prostate health and overall well-being, so individuals consuming spicy foods should ensure they drink enough water to stay hydrated and support urinary function. Furthermore, spicy foods may interact with certain medications used to treat prostate conditions or other health issues. For example, capsaicin supplements or spicy foods may affect the absorption or metabolism of medications, altering their effectiveness or increasing the risk of side effects. Individuals taking medications should consult with their healthcare provider to ensure that their consumption of spicy foods does not interfere with their treatment plan. Lastly, allergic reactions to spicy ingredients can pose risks to prostate health. While rare, some individuals may be allergic to certain spices or chili peppers, experiencing symptoms such as itching, swelling, or difficulty breathing. Allergic reactions trigger inflammation throughout the body, which can negatively impact prostate health. Chronic inflammation is a significant risk factor for prostate issues, including prostatitis and prostate cancer. Therefore, individuals with known allergies to spicy foods should avoid consuming them to prevent inflammatory responses that could affect the prostate.